with. And the first topic we're going to cover is located in the Clinics MD setup guide that we provided to everybody. You can locate this guide, under the Help menu in Clinics MD under the Meaningful Use menu. As you see here, it's broken out by Stage 1 and Stage 2. Select Stage 2, and you can get to the guides that we have provided. The topic that's being covered today is the setup guide. So all the material we're covering today is located in that guide, and we're going to go through the table of contents pretty much one at a time, okay? So the first item we will be covering is the Meaningful Use Stage 2 participation flags. These flags will drive reminders in the system. At first, the only reminder that's being provided is the prompt for you to map your ICD codes to SNOMED codes. That's a topic we will be covering later on in a few minutes and going over what SNOMED codes are and what they're used for. But right now, this flag is driving you to remind you to go ahead and do that mapping, which is critical for some of the meaningful use clinical quality measures. Okay? And as we add more features to the system, we'll be driving other reminders off this participation flag. So let's go to Settings and Account Maintenance. And this flag is located under the Clinic tab, okay? And this has been here from quite some time. Just going to give you some general information on your clinic. Right here you'll see this new flag that was added. That's your indication that you're going to be participating in meaningful use. If you do not have that checked, it doesn't cause any harm. What it does is just won't produce the reminder to you to go ahead and map any ICD codes that are not currently mapped to SNOMED codes. And that will drive other alerts that we put into the system later on. You'll also notice that there's a patient portal enable flag. For all of our participants on the call today, that has already been enabled for you, but if it's not, just simply mark the checkbox. What this does is push all your patients into the patient portal. Another element that was added, and it was just a free text box, is a place for you to enter your clinic tax ID. This is used for the electronic files that are generated for the clinical quality measure reports. They can also be used for your PQRS reporting. If you will be participating in that option, you will have to have your tax ID entered to be included in the file format. Okay? Moving on, we're going to go ahead and show you how to register your providers for the direct messaging feature that's available in Clinics and the MD through the SureScripts network. Okay? And that is located in the ePrescribe tab. This is typically where in the past you would register your providers for SureScripts for ePrescribing. And since this feature is still through SureScripts, we went ahead and located it in this field. Okay? It's a two-step process. You must first set the clinic's name, which is used in the email address that you set up. It's a secure email address through the SureScripts system that allows you to send messages from Clinics MD to other HIEs and other 2014 certified EHRs, and it sends it through the SureScripts network, much like an ePrescribe, and it's encrypted. Okay? So click the Set Clinic Direct Name button, and a field pops up, and it gives you general instructions. The clinic name must be 3 to 20 characters in length, letters only. You can't use numbers, no spaces, no commas, no special characters such as ampersands. Okay? Okay, so we'll be in a format similar to this, no spaces, letters only, and click OK. And now you'll see here that the direct name field has been populated. For this feature, you'll need to exit out of the ePrescribe tab and then re-access it. You may have to log out. So to set a provider's name, what you would do, let me go back here, is simply select your provider and then click the Enable Direct button. And automatically, the provider's email address, direct email address rather, is populated here. Okay? This is the address that you will use when other providers, institutions ask you if they can participate in direct secure messaging with you. This is the address that they're looking for. So you'll just provide this to them. At this time, there is not a nationwide directory available for all the direct messaging addresses that are currently out there. There's several facilitators out there. SureScripts is not the only one. We do provide a directory of SureScripts participants, which includes other EHR vendors such as McKesson, Cerner, Greenway. Those are three big other EHRs that we're familiar with, and also includes other HIEs and HISPs, such as Medicity. Okay, so if they're a participant in the SureScripts network for direct messaging and they have a direct address, it'll be available in the directory they have. But as I mentioned, unfortunately, there's no nationwide directory at this time. Okay. You do have the ability to set the direct address for your external providers that you have up in your provider master list in ClinicsMD. And that is located under the Settings menu in Health Plan. And select the External Provider tab. And you'll notice there's a new field that was added called Direct Address. You can either manually type in their direct address to store it in ClinicsMD, or you can click this magnifying search icon, and it will try and search by last name and zip code for that provider in the SureScripts network to make searching for it a bit easier. Okay, if it's not listed, they're not a participant in the SureScripts system for direct messaging, you'll have to manually enter the address here. Moving on, we've added some clinical decision support intervention alert modifications that weren't previously available with our Stage 1 features that were released originally in 2011. You can find these settings in Account Maintenance while we're here in the User tab, and you set these user by user. Okay? So down here at the bottom, select the Options tab, and you'll notice these alert settings have been added. You can pick and choose who in your office needs to see these clinical decision support intervention alerts that pop up. Not all are applicable to all users of your system, so you can pick and choose who can see them and who can acknowledge them. Previously, only providers had the ability to acknowledge those rules, those alerts that pop up. So now we've enabled it so you can pick and choose who can do it on behalf of the provider. So you can set up ones that are perhaps more geared to your nurses, your other ancillary staff members to act when the patient's first being seen and triaged. Okay? Now we will move on to setting up one of those decision support interventions. Again, this functionality has been available in ClinicsMD since we originally deployed the Stage 1 release in 2011. And for Stage 2, you have to expand upon that capability and enable a total of 5 clinical decision support interventions based on at least 4 of the 2014 clinical quality measures, so to help you better track specific patient populations in your practice. You can make them as granular as you need, very, very specific, patients with a specific diagnosis, with specific demographics, and a very specific lab result. Or you can make them very, very broad. Women, say, above the age of 40 that need to have an annual mammogram. Okay? So to create one of these decision support interventions, first click the Add button, and this adds a new row. This is where you title your decision support intervention so that it's easily identifiable to the users in which it will be displaying the alert. It's a free text field. Next, you set how often you want this rule to be evaluated for your patients. How often do you want it to trigger based on the criteria you're going to be using? By default, it picks 3 months. This is completely editable. So you can either set it for 1 month, 2 months, 10 months, 13 months, 400 months, okay? Depending on how often you need this rule to reevaluate for your patients. So let's do every 6 months. This next column is the effective date range, and this is specifically for your lab and vitals. And this will limit the amount of data that it goes back and looks for lab results. So for instance, let's say you're setting up your decision support intervention based on a patient's A1C score. You want a more recent result so that the intervention is relevant to your patient at that time that it's being evaluated. You don't want it to go back and look at a lab result from 2 years ago. So you can set it for 3 months. You can have it go back and look for lab results within the past 6 months, etc. Okay, so I'm going to leave it at 3 months. The next step is adding the criteria. And the criteria is diagnosis, items from the patient's problem list, drugs, which is done by drug family. And this is done so that you can easily capture all medications in a category, so your brand and your generic medications. If we left it by just specific drug, you would have to make sure that you put in all the possible brands and generics out there to make sure that it captured all those patients. So rather than do that, we decided to go by drug family. You can search by drug name and then pull in all the applicable drug families. You can search by demographics, so specific patient age, and either above that age or below it, gender, and race. So let's say we want to do patients that are above the age of 40 that are female. Okay. Specific lab results, so you can have the rule based on a certain value. Click Add to search for the specific result, and this is categorized by the actual result associated with the order, not by order name. For your panel labs, you'll have multiple results associated with it, and it needs to be granular so that you're tracking the specific result for that patient or for your criteria. Okay, so let's select glucose. Then you'll notice this new field is displayed called Operation. And the available choices are greater than the value, which the value field is here, less than a value, between 2 values, and lab results not between 2 values. So greater than, select your value. Say you put in 400. So when this rule triggers for a patient, it's evaluating the criteria. It's going to look for patients that have this specific lab result greater than this value. Less than would be patients that have a lab result less than this value. Between 2 values, you can set a specific range of patients that you need to track. So this would evaluate patients that have a glucose result, for example, between 400 and 500. So anything between there, such as 400, 401, 402, 450, 475, would qualify for this criteria. And then finally, not between 2 values. Okay? So this would capture patients with this lab result that are outside of this range, so less than and greater than. So your outliers it's trying to grab and bring to your attention. Allergies can either do drug family or specific drug allergy. Okay? And vital signs. Vital signs works very similar to lab results in that you add the specific vital, say systolic, and then the same operations are available for you. So you can capture patients greater than, less than, between two values, and not between two values. Okay? Very similar to how the lab results are set up, but this specifically tracks your vital signs. Circling back to diagnosis, since I did skip over the criteria for that, to add a certain diagnosis to evaluate for your decision support intervention, click the Add button. And search for your problem. And the first option is single code. So when this setting is used, it's only going to evaluate patients that have this diagnosis in their problem list. It's going to be a very specific set of patients. Okay? You also have single range and a specific range between two different codes. So for single range, let's say you want to capture all patients that have a type 2 diabetic rule that is in the 250 series. Select the single range, and then you can modify this field and remove the numbers and the decimal. So now this is going to evaluate patients that have a code, an ICD code, and their problem list starting with 250. Let's say you want to capture two series, patients that have type 2 diabetes or secondary diabetes. You would select your double range, and it will prompt you to search for a different code. Okay? And because you're doing a range, you can then edit this field. So it's going to capture now patients that have either a code starting with 249 through the 250 series. You'll notice to the left of this that there is a new feature that we added as part of 9.0. It's the required checkbox. This was added so that you can set up either or situations. This would both be applicable for single criteria, such as your single code. You want to capture patients that have a specific code, and when you remove the checkbox, you add another code. Say, for example, 249.00. And when you're setting up the rule this way, it will fire in an either-or scenario. So the patient can either have 250 or 249.00 in their problem list. If one of them has the check mark, it means they have to have the specific item in their problem list for the rule to fire. Or they can have 249.00. But this has to be in there. This is mandatory when that required check mark is added. You'll notice this is also available for lab results. Again, so you can set up an either-or series. Patients can have either results of this or this lab result. Allergies and vital signs, they all have the required by field. Okay. Circling back to drugs, since I just skipped over that. To search for drugs by drug family, which is what will be populated in the criteria, unless you know the specific drug family name you're searching for, you can just search by drug name. Okay? You select your drug using the drug search window, and then the specific drug families associated with that drug will populate. And you can pick and choose which ones that you want to include in your criteria. Okay? So that's how you set up the criteria for your intervention. Now you actually have to add the associated interventions, i.e. the criteria. Once the patient evaluates it, what do you want to happen? Okay? And the options available are instructions. These can be either internal instructions for you and your staff to review, or instructions that you can print out and give to the patient. They can be as simple as reminder to schedule a follow-up in 6 months. It can be a reminder for you to do a specific order, or give a specific education or a specific medication. It's a free text field. Okay? And when the decision support intervention window triggers, it will pop up for you, and you can then look at the instructions and then choose to print them or just review them. Okay? The next field is the same, add education. This will allow you to add specific education materials to your clinical decision support intervention, any handouts that you want to give for your patients. Let's say your criteria is based on diabetic patients. The education materials that you may want to include could be diabetes maintenance with food and exercise. It could be reminders for foot checks for your patients that have diabetic neuropathy. Okay? You can include specific patterns. These can either be your typical full plan of care patterns that are disease-specific that you want to go ahead and apply when the patient triggers that rule. You know, say your initial diabetes visit pattern that you want to use. Or they can be very specific and set up to include just orders or medications. So let's say you have your diabetic patient and they have an A1C score greater than 7. You may want to go ahead and evaluate for different medication. You can create a pattern to attach to your intervention that just includes the medication that you want to give to the patient, or evaluate to give to the patient. Same thing with orders. If you know your reminder is in your instructions is to have a follow-up order, the pattern can actually just contain the lab order itself. And the final tab that was added as part of our 9.0 update is this bibliographic reference citation. This is so you can add the clinical criteria that the intervention is based on. So if you're doing rules for insurances that are set up for HEDIS criteria, which is based on NCQA information and guidelines, you can include that information in this field. So when the intervention is alerting the providers, they can go and reference the information behind the rule, the guidance behind the rule. They can evaluate the guidelines themselves. Okay? And the final step, once all your interventions, the informational text, your education, your patterns, and your bibliographic, your reference information, the final step is actually enabling the rule. And you do so just by marking the active check mark. Another item that was added as part of the 2014 certification requirements is this status log. This is to be used in case you're ever audited and they need to prove when an intervention was enabled, because as the criteria states, it has to be turned on during your reporting period, which this year is not 30 days, 1 quarter. For next year, it'll be the entire year. So you can click the status log to show when specific interventions have been enabled or disabled and what date. Anything that was added prior to the stage 2 obviously wouldn't have it captured because this is a new requirement. So when you click it, it'll tell you there's no history. Okay? Let's see here. This one was enabled yesterday, or excuse me, on Tuesday. Okay. Moving on. The next item we're covering today are the clinical summary defaults that were added as part of 9.0. By default, the system setting is that for all sections of a clinical summary, which are labeled here, are enabled, which means any of this information that's in the patient's chart for that date of service will be pulled in automatically into the clinical summary that's either printed or sent to the patient portal. However, you can control what's included in it. Okay? And to control what's included in your your clinical summary, you can set up default profiles for the clinic, and it can get more specific to each provider. Okay. The clinic defaults can be accessed by anybody and will automatically be selected when a clinical summary is provided. We provided some general types. You can use these, and they'll be all blank. Or if none of them are applicable to your practice, you can click Delete. Okay. To set up the criteria for your clinic's default clinical summary, meaning whatever you want pulled into the clinical summary for all users, all providers in the clinic, you select your clinical summary type, and then down below, mark the sections that you want included in your clinical summaries by setting the check marks here in the Include column. If you want to include all of them and just deselect a few, it's quicker to click the Select All checkbox and then modify as needed by deselecting any items you don't want to include. If you want to add your own clinical summary type, click the Add button. Add the title for your clinical summary. Indicate if you want to use it as your clinic's default, meaning automatically selected when you generate a clinical summary. And then again, come down here and pick and choose the sections that you want included. And it will suppress them from the clinical summary. Similar setup for setting specific clinical summaries for your providers. Select the provider name under the list. Select the summary type, and then decide which sections you want to include. If you want that to be the default for your provider, so anytime an encounter that has that provider listed as the contracted provider, it will be used rather than the clinic or the system default. Okay? You can do so just by marking the checkbox. Click the refresh icon or F5 on your keyboard to save. And how that looks when you create it, to pull up a test patient. Okay. click the Clinical Summary button. And you'll see by default that Clinical Summary default profile I just set up for Dr. Robert Smith is selected. You can switch to any other type as needed, say the system default, which has everything selected. But when you first generate it, it's going to use the default that you set up for that provider. If you still need to control the Clinical Summary even further, you can mark to include or exclude any section by just marking the checkbox. You'll see that there's fields that are editable. You can put the cursor in that field and type additional information that may not have been included. Okay? You'll see here under Show Problems that it will pull in all problems. You can also select the current encounter. So only problems added in today's visit. All active problems are the full history, so it's going to be your historical list of problems for that patient. Same thing with medications. It's still either going to pull in all active medications based on the encounter date, or you can pull in the full history, which is going to be both the active, expired, and discontinued medications. And by shortcut, if you want to include all history for the patient, rather than clicking certain boxes, you can just mark the Include History button. Okay. Moving on. I'm going to go back to Clinic Setup window. And we're going to move on to mapping LOINC codes for your lab order results. And these are required for the 2014 clinical quality measures. LOINC stands for, let me backtrack there. It is a universal code system for tests, measurements, and observations. And it's used as nomenclature to standardize the terms used for specific lab results. In the past, prior to the involvement of the meaningful use criteria, each lab could have their own definition or description of specific lab order results. LOINC, which is a numerical system, standardizes it. So a result from one lab is the same as the result for the same lab order for another lab. Okay? And this standardization makes it easier for systems such as EHR systems to better track for quality measures for specific lab results. So your patients that are diabetic and have an A1C score, this allows them to have a universal idea of the lab results for the patients when you're reporting quality measured data. Okay. So to establish and set up your LOINC codes, you would first select your lab order, and then at the bottom, select a specific result. And LOINCs for lab are lab results specific. If you know the LOINC code, you can manually type the number in, or you can search for a specific LOINC code. You can search by description. Okay. For our clients that have lab interface results set up, if the lab is sending this data, we will automatically include it in ClinicsMD. Quest sends the LOINC numbers for their lab results, so we will automatically incorporate that in ClinicsMD. Okay. this search feature has been made available in case the lab is not sending the LOINC values, so that those clinical quality measures will track appropriately and then be included in the electronic file format that is generated. Okay. LOINC codes are also used for clinical quality measures involving radiology orders. You can either manually type in the number or you can use the same search icon. And scroll through and search for the appropriate LOINC code. And it will automatically insert it into this field. Again, this is used for the clinical quality measures involving radiology orders. For example, breast cancer screening mammograms. You'll also notice to the right of the LOINC field is this checkbox column to indicate which lab orders in ClinicsMD will have an image associated with it. And this is specifically for one of the meaningful use stage 2 core and menu set measures, in which you have available in ClinicsMD images for radiology orders. The denominator for that measure will only include your radiology orders in which you've indicated images will be made available in ClinicsMD. All you have to do is mark that checkbox. So in this case, only patients with this radiology order and this radiology order would be included in the denominator for the associated report measure. Okay? Moving on, we will go ahead and cover the immunization order setup in ClinicsMD. We've made some changes to that for stage 2 to accommodate the requirements needed for both the clinical quality measures involving immunization orders, such as the childhood immunizations and the flu immunization clinical quality measures, but also for your immunization reporting requirements. Okay. So you select your order, your immunization, your vaccine order. Then click the Add button below, and you'll see 3 new fields that display on screen. The first item is immunization code. This is our way of displaying the CVX code, which are assigned by the CDC to the specific vaccine order in ClinicsMD. Click the drop-down arrow to access the full list. You'll notice at the bottom that the CVX codes that are no longer active are displayed in bold and red. I encourage you to review your list in ClinicsMD that you have currently set up and make sure that none of the immunization codes you currently have selected from previous year's reporting are not displayed in red. If they are, it means that code is no longer active and you need to update it. Simply just coming down to the drop-down list and selecting the appropriate CVX code. The numerical code is listed here on the left, and then the description is here, right to the right of it. Okay. Once you have the CVX code, otherwise known as in ClinicsMD the immunization code, selected, you'll be able to set up the manufacturer code. And the manufacturer codes associated will will be limited to those that are associated in the CDC data with this CVX code, 52. So based on that information, there's only 2 manufacturers that make that vaccine, GlaxoSmithKline and Merck & Co. Okay, so select the manufacturer code. The third field was newly added, and it's funding type. This is specific to immunization registry reporting. In some states, they require their clinicians, the practices, to track their stock based on what the state provides to them. And the way they do it is to indicate the funding source of that vaccine. If it's federal funds that are paying for that vaccine, such as for rural healthcare facilities, you would select federal funds. If it's the state funding all your vaccine orders or that specific vaccine, you would indicate state funds. If it's private funds, meaning you're purchasing the stock yourselves, you would indicate private funds. There's other options, and these are standardized across the board for every state immunization registry. Okay. So when this specific vaccine order is charted for your patient, this information will be pulled in to the immunization registry file that is generated in ClinicSMD. And we'll be covering how to generate that in our next Meaningful Use webinar series that begins next week over the core and menu set criteria. And while we're talking about immunization registry requirements, I'll go ahead and move on and show you a couple additional fields that were added to patient information, their demographics, specifically for immunization registry reporting. So this is on patient-by-patient setup that you need to do. If the patient is a multiple birth patient, twin, triplet, etc., you would indicate yes or no. And if your answer is yes, you must select their birth order. This is most relevant for pediatrics. Okay. The next item is the immunization protection indicator. And there are 3 statuses: no determination, it's not necessary to protect the data, meaning sharing is okay. This means the immunization registry can share that patient's immunization history with other doctors that may query it and request it, or other sources. And then the third status is protect the data, do not share. If this is set when the immunization file for the patient is submitted to the registry, this information is passed along, and that's their indication to protect the patient's data in the immunization registry. Third item that is added is the immunization registry status. And this is, again, specific for the patient. It will either be an active patient in the registry or an inactive patient, and these are the list of appropriate responses. So if you know your patient, you're submitting their immunization history for the week, but you know next month they're moving out of state, you would indicate that they've moved or gone elsewhere. And when this information is uploaded in your file, for your weekly file, to the immunization registry, they would then have this information to indicate and inactivate the patient in their registry. Okay? We'll go over all of this in more detail when we get to that in the next week's webinar sessions for core and menu set information. Okay, we're going to move back to clinic setup. And we're going to cover now the ICD and to SNOMED mappings in ClinicSMD. SNOMED is used to better track specific problems and conditions for your patients. It's much more granular data set than ICD-9 codes alone. It is maintained by the International Health Terminology Standards Development Organization. And it is very, very, very comprehensive. This information is used in the 2014 clinical quality measures, and it's also pulled into the CDA files that can be generated and sent electronically through direct messaging. CDA just stands for Clinical Document Architecture, this specific file format that's generated. These files are an electronic file format that allows EHRs that have the capability to electronically reconcile the patient's medication list, problem list, and medication allergy list, to electronically incorporate that data in their EHR to ensure the information is up to date and accurate, rather than relaying perhaps an outdated printed format or word of mouth by the patient. Okay? So this information, these SNOMED codes, are the identifiers that are used to pull in that information in their system. What I'm going to review with you is how to do your general mappings for your clinic's preferred ICD code list and the codes that are most commonly used in your practice. And then I'll move on to showing you how you can chart and map on a patient-by-patient basis. The general mappings, again, are used across the board for all patients, but I'll show you that some of the SNOMED codes out there are very granular and very patient-specific, so that you can map for your specific patient, either episode or across the board for all the encounters for your patient, a much more specific response. Okay? So in the ICD tab, which is your clinic's preferred list of ICD codes, you'll have your list of codes, and you'll see this new column that's been added with this magnifying glass search icon. If it's in black, the ICD code already has a SNOMED mapping. If it's in red, it does not and needs to be taken care of. Where there is a one-to-one mapping available, we've done it for you. They did provide general equivalency mappings data for EHRs that they can incorporate, because sometimes there's a one-to-one relationship. If there's a one-to-many relationship or no mappings available at all, it's displayed in red. Okay? Click the icon. You'll see the ICD code and description, and you'll see that it's not mapped. Down below in the lower half of the screen, it defaults to the predefined mapping. If there is a one-to-many relationship, the list of multiple SNOMED codes that are applicable will be displayed in the lower half of the screen, and you pick the one that's most appropriate. If there is not a one-to-many relationship, meaning there's not a list of suggested predefined mappings, you will need to search for the appropriate SNOMED code. You can search by descriptions, okay? So click Search. You could then choose to do your search with either it must start with a certain word or words, or can contain it in any pattern. So for this instance, let's do first myocardial infarction. Click Enter or Search, and the list of associated codes are then displayed below. You'll notice that there are a couple of duplicates, and that's because we incorporated both the British and the U.S. extensions, because both are used in the 2014 clinical quality measure definitions. There's not a right or wrong way to do this, because they're both included in the definitions for the associated quality measure reports. Select the appropriate SNOMED code and description, then click the Map button. Then we'll update up here to indicate that that code has been mapped. Click OK, and you'll notice now that the icon is black. Okay, so that's how you do your generalized mappings for your practice using your clinic preferred list. If you have any codes in the all list, meaning the full ICD code list, you may not use it as your preferred list in Clinics MD. It may be one that you only use occasionally. To add one of those, you just click the ICD SNOMED map, and what you'll see here is the list of codes that have already been mapped and the specific ICD SNOMED ID code that it's mapped to. You can then click search to search predefined mappings, and you can also print this list. Okay, so let's move on to the patient. Patient is going to be diagnosed with type 2 diabetes. We see here that there's already a general mapping for that patient, or for that specific ICD code. This is set up in your preferred list. It's already been done. But for this specific patient, there may be a more specific ICD or SNOMED CT ID code that is much better for that patient, much more granular and specific. So click the search glass, and the predefined mappings that I mentioned earlier are displayed below. You can then scroll through and look at all of these and see if there's more specific one. For example, for this patient, their diabetes type 2 is controlled by diet only. Okay. Again, not very good code to use as a general mapping for your entire clinic because this isn't applicable to all patients, but you can do so for a specific patient. Let's say that they're diabetic, but it's being controlled on oral treatment, oral medication like metformin. You could select that item. Okay. If it's an episode-specific event, meaning it's just for that date of service, you would indicate that you only wanted to map it for that one date of service. So it would only show up in that patient's data for one visit. If it's applicable to the patient for all visits, mark that checkbox. Click Map, then maps it just for that patient's record only. And click OK. Okay. You'll see here in the general data that your general SNOMED code that it's currently mapped to is still diabetes mellitus, adult onset, but for this specific patient, it's diabetic on oral treatment. Okay, and click OK. Again, this information is used in the background. It's data capturing that's then used in those CDA files that are generated for electronic transmission and also your clinical quality measured data. It's not really seen on screen or even used on screen for any purpose, so we've chosen to just hide that data. Okay? But if you ever need to view it, click that icon, and it tells you down below what it's mapped to for that patient. Okay? Moving on, we're going to go back to clinic setup and review the SNOMED mapping for medical history. This is specific for the menu set measure in your stage 2 criteria that makes sure that medical history is being documented for at least one first-degree relative, so a mother, a father, a grandmother, either paternal or maternal. Okay? Where we can automatically identify and map, we have done so for you. So mother to mother, father to father, twin to twin. If it's not mapped, we were not able to do a match, click the search icon. By default, nothing's going to be displayed because a match couldn't be performed. So let's say it's for a twin sister. Type in sister and select the appropriate description. Then updates and shows that it is now mapped. Okay. The next step is to map the specific disease or condition for the specific family member that they have in their list. Okay? So up here is the family category. Down below is the problem-specific or condition-specific category. If it's available to be mapped, we've already done it for you. If not, or if you're adding a new entry, same search method, click the magnifying glass. And indicate the appropriate SNOMED code, SNOMED CT code. Click OK. And now it's mapped. Again, this is used specifically for your automated core and menu set measure reporting. Okay, moving on to the next item on our list is the patient's preferred communication preference type. This feature was initially added in our original Stage 1 release back in 2011. It's going to be used in Stage 2 reporting for patient reminders because they must be sent out, if applicable, based on the patient's preferred contact type. So just covering this today to remind you that you have full control over this list. It's clinic defined. By default, we provide phone, mail, and email. And phone is used as the default when setting up and adding a new patient. You can control the default for the clinic if needed. You can add any communication types that you prefer. It is free text entry. Okay. Okay. This is, again, used in patient demographics in the contact type. If you select email as the patient's preferred contact type, this information is stored in the address field in their additional demographics. Okay. Moving back to clinic setup. Next item is actually the reminder types. This is the feature that we had to add as a result of our 2014 certification testing we went through. Previously, for the associated provide patient reminders core and menu set measure, you could manually enter the numerator for that measure in the report, and we would store it, and it would be generated in the printout. They no longer accept that method. It must be tracked in the EHR in order to be certified and then automatically pulled into the report when search criteria is entered, such as specific provider name and the date range. So to accommodate this requirement, we added a new tab in Encounters in Patient Information called Patient Reminder, and the associated reminder types that you provide in the office. We have added default reminder types in the clinic. These are editable. If they don't apply to your practice, you can select the item and click delete. To add another record, click the add button and free texture entry. And click F5 to save or the refresh icon. Okay. These are then used when you're actually documenting the reminder type that is given to the patient. You can do so either in patient reminders. Click Add. You can indicate if it's been sent or declined by the patient and the type of reminder that was given. It will then pull in the patient's preferred contact type. If you provided it in a different way for whatever reason, say a mailing, you could select mail if needed. So again, that can be documented here in patient reminders, in patient information. It can also be done in an encounter. Okay. However, you do not have to open the new encounter strictly to document this information. You can record it in patient information if there's not an encounter open. Moving on back to clinic setup, we're going to cover the new care plan setup. This correlates to the care plan section of the clinical summary that is generated in the encounter from the progress note window. In our initial 9.0 release in April, it was a free text entry field only in the clinical summary window from a patient encounter. However, it will get very time-consuming and repetitive if you're typing in the same information over and over again for your patients. So we included a way to set up default care plan goals and instructions for your practice here in Clinic Setup in the Care Plan tab. This is free text entry, and we provided defaults for you. If any of these are not applicable to your practice, you can just click delete and it will be removed. To add new entries to your list of clinic goals and instructions, click the add button. Okay. These are then entered in either the Care Plan tab in an encounter, or you can document it in any of the template windows in this new Clinical Care Plan field. Okay. which brings me to another feature we've added in which you can actually pull in the template notes, so information you're already typing or selecting in your templates, specifically in your plan of care and your plan tab, into that care plan instruction field. Okay? So just click Create. And it's going to be based on your clinic's default setting, okay? So it's either going to use your clinic default, which are those clinic default care plans we just created in clinic setup, template notes, or blank. Okay, in this case, it was set to blank, so no instructions were provided, but you have the opportunity to add it here at this time if you so choose. Okay. It's set to template notes. Click Add. It will then use the text already entered into your template. Okay? Since a lot of our clinicians are already documenting the plan of care, your goals and instructions, et cetera, that are being given to the patient in your plan of care template, if you choose to use the setting, it'll then pull them in automatically. So you don't have to use the defaults that we provided to you in your clinic settings care plan setup. You can opt to use the text being entered into your template. Okay? And then click OK. That information is then pulled in to that clinical summary that is generated in the care plan field. Here's the care plan section. And here are the template instructions that were pulled in. And here's when using the clinic default instructions. Okay? Again, to recap, you can either document that information from within any of the templates, or you can use the newly created care plan tab. We've given this default to all providers, and you'll find this new tab under your Enable tab, so your non-default clinic tabs. Okay. Either way is acceptable. It just depends on your practice's preferences. Now to set your clinic's preferred type of care plans, it's set up in Account Maintenance in the Clinic Location tab. Select the appropriate clinic. You'll see these new care plan default instructions. This is where you choose to set up what you're going to use in your clinic. It's either going to be blank, meaning blank instructions. You want to use your template notes, so any of the text that's entered into your templates, and pull that into the instructions. Or if you want to use the defaults that we provided, the area and clinic setup. So to recap, the clinic default are these goals and instructions set up in clinic setup in the care plan tab. Okay? So you choose what you want to use and how you want to document it. This is optional. You don't have to use it. You can continue to free text when you generate the clinical summary. These are just some shortcuts that were added to streamline the documentation process to prevent the repetitive typing of the same information over and over again for different patients. Okay? The final item on our list today is the assigning of insurance type, otherwise known as payer types, for each of your insurances in Clinics MD. This final step is only required if you're going to be participating with the PQRS CQM reporting that's now available using the electronic file formats that are available in Clinics MD. You can use your clinical quality measure reports for your PQRS reporting for the entire report year 2014. So when you're attesting this year, at the end of the year, for your 2014 clinical quality measures, you would indicate that you're going to report both your quality measures and PQRS together for the entire year. So in other words, not just a 90-day period. And this information would set up for your patients is going to be included in those electronic file formats. If you will not be participating in that option, you will be manually entering your clinical quality measure data during attestation. You do not have to do this step. Okay? So this final step, you would head to Settings and Health Plan and pull up your insurance master list. Health plan names are very all over the place. They vary greatly from clinic to clinic, state by state. And a lot of times it's dependent on how it's set up in each practice management system that's interfaced with Clinics MD. Because there is no standardization in insurance plan names from system to system, this payer type is a way to standardize that information. So when these quality measure reports are analyzed, they can use the data and review it and indicate on a payer-by-payer level the care that was provided for each patient. They can further break down their analysis. Okay. So to set this up, you would first select your plan name at the top, and in this newly added payer field, select the appropriate payer code and description. Okay. This is a standardized set. We don't have control over the list. And because there's not a clean way for us to map insurance plan description to specific payer type, in other words, there's not a clean way for us to identify which Medicare plan is the Medicare, traditional Medicare versus Medicare HMO versus Medicare fee-for-service. You will need to do the mapping if you'll be participating in the electronic PQRS and CQM reporting. Select the appropriate item. If it is a Medicare type, we'll automatically mark the Medicare flag. Okay. So that covers all of the criteria we will be going over today. These are just specific setup instructions needed for your core menu set measure reporting in addition to the clinical quality measure reporting, and as I touched on also the immunization reporting. Okay? So now I'm going to open the floor to your questions. As I mentioned earlier, there is the ability to ask me questions here in your menu. Just select the question field and type in your questions, and I will go ahead and start answering them one at a time. If I need clarification on something that you've entered, I will unmute your phone and let you go ahead and speak. Okay, so I'll give you a few minutes to go ahead and start answering questions. Okay, you guys are a quiet bunch today. I only have a few questions that have come up, and actually most of them are related to criteria we'll be covering in next week's webinar series, which covers the core and menu set criteria. I'll go ahead and briefly touch on these and then also guide you to participate in those sessions as well for further information. The first question is about the clinical decision support interventions, if it's a requirement to have the bibliographic reference citation added. Yes, when available, it is required since the 5 CDS rules need to be based off clinical quality measures, and there's clinical guidance available with the for each quality measure spec. Most of it's based on HEDIS NCQA data. And next week, we'll not be reviewing exactly what needs to go into PQRS reporting. We will touch on that during our clinical quality measures reporting webinars that start the first week of September. The next question is about clinical summaries, what exactly needs to be included in that. We will be going over that in greater detail next week, as that is a core measure as it was in stage 1. I will also guide you to the meaningful use checklist that we provided, and is also available under the help menu in Clinics MD. This checklist has all the links on the CMS website for each measure, including the clinical summary measure that breaks out the specifics for a valid clinical summary. The final question I have is regarding immunization reporting for a podiatry office. Yes, it is. You have an exclusion available for that measure. However, they do encourage all practices using a certified system to produce at least one test of the capability. But there is an exclusion available that if you don't give any immunization, such as a specialist as podiatry, you do not have to participate. Do I have any more questions? Okay, well, I don't have any more questions from the field. Again, you guys are a quiet bunch. This concludes today's webinar series. This is just strictly covering the setup features, as I mentioned. We will be moving on to the core and menu set measures in stage 2 next week. This webinars are on Tuesday and Thursdays. And Tuesdays it's from 2 to 4 Central, and then on Thursdays it is 10 to 12 Central. We are concluding about 30 minutes early today, so have a great afternoon, and I look forward to working with you all. Feel free to send any questions you may have that's specific to this criteria covered today to mary.brunson@clinicsmd.com. Thanks, and have a great day.